I'm Dr. Jennifer, and thank you for choosing Chiral as your healthcare partner. In this video, we will be demonstrating how to perform an injection as part of your program. You're going to need the following supplies before you get started. A sterile syringe with a needle. The syringe will have an orange cap covering the needle. It may also have another orange cap over the plunger, but not every syringe has this second cap. You will also need your prescription medication. It comes in a vial that may be packed in between ice packs. When not in use, the medication needs to be refrigerated. Next, you'll need alcohol prep pads. And finally, a sterile bandage, cotton balls or cotton pads. Before getting started, take a note of the dosage on your prescription label. It will also be helpful to look at the barrel of the syringe to find that number. It's very important that you don't go over the amount you were prescribed. When you're ready, start by washing your hands thoroughly with soap and water. This will help to prevent bacteria from getting into the vial and contaminating the medicine. Once your hands are clean, open the alcohol swab and clean the top of the vial. Remove the orange cap, being careful not to touch the needle to anything. If there is a second orange cap over the plunger, you need to remove that as well. With your other hand, hold the vial upside down and use your other hand to insert the needle into the vial. Make sure the needle is all the way in and there are no air bubbles in the syringe. Now, slowly pull the plunger of the syringe back to the correct dose of medicine. Make sure you are drawing the correct amount of medicine and don't touch the tip of the needle or let it come into contact with anything. Double check that you've drawn the correct dosage, then carefully remove the needle from the vial. Again, make sure not to touch the tip of the needle or let it come into contact with anything. Now, let's administer the injection. On your body, the best injection sites are the lower abdomen or the thigh, but if someone else is doing it for you, use the tricep. I'll be demonstrating how to do an injection on this grapefruit, but you can perform it on your own easily. Once you've picked the location, use the alcohol swab to clean the area of the skin where you will be injecting the medication. Next, hold the syringe like a pencil with your thumb on the plunger. Gently tap the syringe with your fingers to remove any air bubbles. Then, pinch a fold of skin between your thumb and forefinger and hold the syringe at a 45-degree angle to the skin. Carefully insert the needle into the skin and then push the plunger slowly to inject the medication. After the medication has been injected, carefully remove the needle from the skin. With a sterile bandage, apply gentle pressure to the injection site. You don't need to rub the injection site. Dispose of the syringe and needle properly, such as in a puncture-proof container or a milk carton. And that's it. By following these steps, you can safely perform injections as part of your Chiral program. As always, if you have any questions or concerns, be sure to consult with your healthcare provider.